This week we're going to cover the pelvis and the bones of the pelvis, the bony landmarks, and the powerful muscles of the pelvic region. This is an anterior view of the bones of the pelvis, and you have three bones, which are the ilium, the ischium, and the pubis. Together they form the acetabulum, where the head of the femur fits. This is the iliac crest, and you can see how thick that bone is. The sacroiliac joint, there's very little movement that's allowed here. There is some, however, it's very small movement that's allowed at the SI joint. The anterior superior iliac spine, which you can feel by placing your thumbs on the posterior side of your iliac crest and your fingers in the front, and you should be able to palpate the anterior superior iliac spine. The anterior inferior iliac spine, and the ischial tuberosity, commonly known as the sits bones. This is a lateral view, and this view shows the PIIS, or the posterior inferior iliac spine, and the ischial spine. Here you have the pubic tubercles, and again, notice how thick the bone is here. This is the attachment for the powerful adductor muscles. This is the obturator foramen, foramen meaning hole. This hole is covered by the obturator muscle. This picture shows the PIIS and the ischial spine looking right through the bowl of the pelvis. And again, you can see the articulation of the femur and the acetabulum. This is a posterior view. And here we see the posterior superior iliac spine, which we haven't seen before, and the PIIS and the ischial spine. Here we find coccyx at the end of the sacrum. This is a picture of the coaxial, or the hip joint, and the acetabulum. What I want you to do is to compare the acetabulum and the hip joint with the shoulder joint. This picture here shows the labrum, the thick, deep labrum that holds the head of the femur in place. In the shoulder joint, the labrum is not so wide. It's a more narrow labrum, so that it provides more flexibility but less stability. The deep labrum of the hip joint allows us to have lots of stability in this joint without the flexibility of the shoulder joint. Here we have the head of the femur, the greater trochanter, which many people think is the hip joint. So people say, oh, the bump on the side of my hip, my leg, that's the hip joint. Well, it's not. It's the greater trochanter. And then you have the lesser trochanter on the medial side. In between those two trochanters is the intertrochanteric crest, the gluteal tuberosity here, and the pectineal line. This is the posterior view. You can tell because you have the greater trochanter is on the lateral side of the picture. The lesser trochanter is more posterior. This is an anterior view of the femur. Again, the head of the femur, the neck of the femur, the greater trochanter, and this is the intertrochanteric line. At the distal end of the femur, you have the adductor tubercle. So the adductor tubercle on the medial side. So this is a posterior view of your right leg. This is the adductor tubercle, medial condyle, lateral condyle, intercondylar fossa. Again, remember, fossa meaning hole. So intercondylar fossa means the hole between the two condyles, the medial and the lateral condyle. Here is the tibia, and this is the small fibula. This picture shows an anterior view of the knee joint, showing the patella as it sits on the femur. And this is the linea aspera, again, the posterior view of the femur. We're going to now talk about the gluteal muscles, and there are three: the gluteus maximus, the gluteus medius, and gluteus minimus. These muscles, the maximus and the medius, are actually antagonists to themselves, just like the pectoralis major and the trapezius, because their muscle fibers run in opposite directions. So the gluteus maximus is responsible for extension of the hip, rotation of the hip, lateral rotation, abduction of the hip, and adduction of the hip. So what I want you to look at are the muscle fibers here. So all of the fibers can extend the hip. So they bring the hip towards the posterior of the body. So acting together and with the synergist muscles, the hamstrings, they can extend the hip. They can laterally rotate the hip by taking the hip and moving it towards the outside laterally, external rotation. And they can abduct the hip by working together, which would be bringing the leg out and up. The lower fibers here can adduct the hip. So when they act alone without the upper fibers, they can adduct the hip. They bring the hip back in towards the midline of the body. This muscle also counteracts gravity when you're sitting. The gluteus medius, this is a picture of the gluteus medius. This blue spot right here is a flexor. And this also shows a picture of the lateral hip rotators. When all of the fibers act together, they can abduct the hip, bringing the hip out away from the midline of the body. The anterior fibers can flex the hip, and they can medially rotate the hip. So they bring the hip towards the midline of the body. The posterior fibers extend the hip and laterally rotate the hip. So you can see how the posterior and the anterior fibers make this muscle an antagonist to itself. This is a lateral view of the medius, and this gives you a better picture of how the anterior fibers and the posterior fibers can be antagonists to itself. The gluteus minimus is the smallest of the gluteal muscles, and this muscle can abduct the hip, medially rotate the hip, and flex the hip. This is the only gluteal muscle that cannot act in opposition to itself, that cannot be an antagonist to itself. And it is attached more anteriorly than the other muscles. And this shows the anterior view, and you can see clearly how it is attached more anteriorly onto the femur. We have lateral hip rotators. There are 6 of them. The most important is the piriformis, and we're going to learn a lot about the piriformis and how to massage that. This is superficial to the sciatic nerve and is a major cause of sciatic pain. This is a picture that shows the lateral hip rotators and their attachment site on the trochanter, the great trochanter. So you have the piriformis and the gemellus superior, obturator internus, gemellus inferior, and the quadratus femoris. These muscles their prime purpose is to laterally rotate the hip. So if you look at the size of the muscles, the attachment site, greater trochanter, you can imagine how powerful these muscles are. This is the obturator internus, and this picture shows how it covers the obturator foramen. We've covered a lot of the muscles of the trunk and the gluteal portion of the body, the lower portion of the body. These next two slides show how these muscles work together to control the pelvic girdle and how important it is to maintain abdominal strength and back muscle strength. And we talk about core strengthening. This is why it is so important. This picture shows your pelvis here, and this is a picture of how your erector spinae muscles, which are pulling upward, and your hip flexors pulling downward, and how they act together to cause anterior pelvic tilt. So if one is stronger than the other, you can see how it's going to move the pelvis. The second picture shows how your abdominal muscles pull up on your pelvis, and your glutes and your hamstrings are going to pull down on your pelvis, causing a posterior pelvic tilt. So you have 4 sets of muscles here that are acting on your pelvis. You have the erector spinae, and you have the the hip flexors, iliopsoas. You have your trunk flexors, your abdominals, and you have your hip extensors, the gluteals and hamstrings, and how they must be in perfect balance with each other. And by having them in balance with each other and attaining a strength of balance in all of these muscles, you can avoid back pain. It's not good to have strong back muscles without strong abdominal muscles, or to have strong hip extenders, the glutes and the hamstrings, without having strong trunk flexors. So all of these muscles work together to control the position of the pelvis.